health matters now. Half of the world's population don't have access to essential health services due to high costs. According to the World Health Organization, 100 million people are pushed into poverty every year because of high medical bills. In 2015, world leaders committed to a set of United Nations Sustainable Development Goals, which included accessible, quality healthcare for all people without financial burden by 2030. But as Sumitra Naidu reports, it's a tall task for many African countries.
Providing affordable healthcare has become a key priority, but it's a tough ask for countries who are already struggling to cope.
With the limited resources in Africa, there is no way that the public sector is going to have adequate resources to look after the 1.2 billion people on this continent. And there's no way that the private sector can do it alone, because not everyone can afford private healthcare services. So the effective mix between public and private is the answer to improve health on Africa.
Egypt is the only country so far to have achieved universal health coverage. Kenya has plans to cover its citizens by 2022, while South Africa has just published its national health insurance bill. Some countries, though, are lagging way behind.
We are not even at a stage where we have a green paper, so a rough policy document roughly on universal healthcare. What we acknowledge as a nation is that we need to wrap it up. We need to make sure that everybody has equal access to a public health facility.
In many African countries, it's not just about making healthcare affordable, but more about creating access, and that can't be done without the infrastructure. Massive investments are needed to transform Africa's ailing health sector.
Primary healthcare is the most critical part because it's the most cost-effective way of, first of all, preventing people from going into hospitals. And once they are there, then it helps them to tackle the issues or the condition at a lower level before they have to move to higher levels.
Once we keep our people healthy, they will live longer. And looking at the demographics of Africa, we have a lot of young people. And if these young people are covered from birth and from a young age, and data is collected, and we use innovative ways, we will be able to manage their health better.
Every year, 100 million people across the globe become poorer because of exorbitant health bills. Out-of-pocket expenses account for more than 30% of all healthcare spend. This is why the universal healthcare model is being seen as an important step to make services more inclusive and affordable. Sumitra Naidu, CGTN, Johannesburg, South Africa.